Hello, my name is Dr. David Dubin. This is the first in a series of training tapes that by the end you should feel much more competent, confident, and look forward to starting your practice as a practitioner of direct neurofeedback. Okay, hi, Curly, right?
Yes.
What brings you here? How can I help?
Well, I've had a long history of PTSD, post-traumatic stress disorder, and an anxiety disorder. It really makes it challenging for me to function. So I heard that direct neurofeedback could be very helpful in that regard. So I'm here to hopefully get a solution
Okay.
to my issues.
Are you on any medication?
No, but I do take supplements.
Okay, okay. Do you have other people in your family have anxiety issues?
My father has, he doesn't manage stress very well. I think he has a history of a little trauma in his family. My mom definitely stresses out, but I've had trauma. So I actually have a diagnosis of PTSD.
Okay, okay. It's we look at it as it's on the anxiety spectrum, but at one end, at the extreme end. And all the way at the very mild end, actually, I think of it as kids who are embarrassed easily, who become self-conscious. That's actually a mild form of anxiety. And even though we may not think that much of it, it's a big deal if you're young, and it can really restrict your world tremendously. So that's a very real thing too.
It's actually interesting that you say that because as a child, I moved schools a lot. I was always the new kid. I was really sensitive. My mother would, she'd get upset and raise her voice. And so I was just around that.
Right.
And I used to have a lot of fear, nightmares, and things like that. So I was a very sensitive child. So being always new, my world, I didn't have a lot of stability
Right.
growing up. So I was pretty nervous.
Well, do you have other symptoms related to anxiety, like panic attacks, like insomnia?
Yeah, I've had insomnia since I was about 16 years old.
Okay.
Difficulty sleeping. I always have to take something in order to help me get to sleep. I get acute stress, where I guess it was almost, I never had to go to the hospital for a panic attack, but where I would be laid out, I'd be immobilized.
Okay.
Sometimes I couldn't drive. It's been really challenging.
How often do you get it like that?
Since I have certain supplement, I take a lot of supplements for my nervous system, but it used to be every day.
Really?
Yeah, every day around 4 o'clock, I would just get, strangely, it would almost go in cycles, like 11 a.m. I would start to feel really amped up, and then around 4 p.m., I would just go into a stress cycle, and I'm never sure why. So I'm always taking different herbs or whatever to manage
Right.
my symptoms.
And how often do you get it now?
I still have it almost, it feels like an ever-present
Okay.
thing for me. You know,
But
it doesn't go extreme in the same way. But like I said, I'm always
Right.
taking something to make sure. If I don't take anything, then it would probably happen every day.
Okay, so you have like a generalized background anxiety, and occasionally it flares up and gets a lot worse.
Yes.
Is that fair to say?
Yeah. If I'm under stressful circumstances, if there's,
Right.
I don't handle life stressors very well.
Right. Okay.
I'm easily triggered.
Okay. Do you have questions for me about this?
Yeah, I've heard a little bit about it, but I don't really know how it works exactly. Like, what does it actually do? I know it's stimulating the brain in some way, but what does it actually do? Yeah, how does it work?
Okay. It's kind of a combination of neurofeedback, feedback, and microstimulation. But in its simplest terms, it's a very tiny microcurrent that goes from the system back to your brain. There's feedback in it, in that it's constantly monitoring what your own brain waves are doing, and the signal that gets sent back is varies based on what your own brain waves are doing. And we don't fully understand it, but one of the basic things it does, it diminishes that part of the nervous system, that part of the autonomic nervous system, the fight or flight we call it the sympathetic nervous system. It diminishes the fight or flight and enhances what we call parasympathetic, which is rest, relax, and recover. So it very directly helps with anxiety, which is really a chronic state of being in fight or flight. Now, interestingly, when someone has panic attacks, that they resolve very quickly within just a few sessions. It's really the chronic underlying generalized anxiety that takes longer to treat. But the panic attacks are like an instability, and it's not that hard to deal with, just the instability part. So, and we do very well with treating anxiety, probably 85–90% of the time. We get very good results, and people are very happy with the outcome.
I'm excited to try it because, yeah, I'm familiar with the sympathetic nervous system and the I feel like I'm in fight or flight
Right.
On some level, mostly every day.
Right.
So what should I expect to experience
Okay.
when I go home tonight or over the next few days, just so I can be aware?
Sure. Well, what's going to happen is I'm going to clean your skin, and then we're going to put on a little paste, and then we're going to attach these 5 sensors, and that will pick up the electrical activity of your brain. It's going to come down here to the amplifier and computer, and I'll be able to see information here, but what happens with you is there's a tiny trickle that goes back to you. It's far weaker than a cell phone, and you won't notice anything, okay? And you'll just sit there. That's your job, is just to pay loose attention to what you're feeling. And I'll explain more of that when we do it. Most of the time when people go home, they feel relaxed, they feel good. Sometimes they're tired, sometimes they're a little bit spacey, and we'll go over all that when I treat you. But far and away, what people most likely go home feeling is relaxed and good.
Okay.
All right.
Are there any safety precautions? Is there anything that any side effects or anything I should be concerned about or aware of?
Well, in terms of safety, remember, it's weaker than a cell phone, okay?
Which seems so surprising.
I know. It's hard to believe it does anything, except that it does. And it's only going to be on for seconds to a few minutes, so you get much more just when you talk on the phone. Okay. And even though most people haven't heard of direct neurofeedback, it's actually been around since the 90s. So in that time, far more than 250,000 people have been treated. And I'm not aware, nor any of my colleagues aware, of anyone being worse off from having done it. So it's extraordinarily safe. It'd be hard to think of something that's safer, other than water, maybe. So there's no concern in that regard.
Okay. Well, I've heard really great things about it, so I'm excited to try it and just hopefully it can help me.
Well, we know very soon. I mean, one of the really good things about this is we know within 3 sessions whether or not it's going to help. In fact, we usually know on the first session whether or not it's going to help. And then if it's not, we don't waste time or money, and we just move on. But usually it does.
I'm hoping that it works.
Okay. So shall we start?
Yeah. Should I have my eyes open or closed?
No,
Does it
leave
matter?
them open.
Okay.
And I don't want you to try and do anything. I don't want you to meditate. I don't want you to...
Just relax and enjoy.
Right,
Okay.
and I don't want you to try and relax even. I don't want you to make yourself feel good ahead of time.
Okay.
Because the main way I can tell what you're experiencing, one of the most common markers, is whether or not you're relaxing. And if you're relaxed ahead of time, I'm giving up one of my best markers to see what the effect of the direct neurofeedback is on you.
Okay.
And that's why I keep the eyes open too. Many people doing neurofeedback have eyes closed, and excuse me, and they're afraid that blinking can cause some interference, and they want to get exactly the right frequency. But it doesn't really matter that much here. And we tend to get sleepy when we close our eyes, and that's not what I want.
Okay.
We want you awake
Just
to
hang
notice
out.
what's going on. Right, and when you get sleepy, you usually relax also, and that's not what I want. So this is actually just an exfoliant, and I'm getting dead skin. And I'm just putting them in the standard locations where we put the sensors. There's nothing special about these locations, however.
Yeah, I was going to ask, how do you know where to put them?
These are chosen largely arbitrarily, but I don't put them where there's hair. And it turns out that it really doesn't matter that much where you put them, because it's not strong enough to really be stimulating neurons like TMS or even electroshock. This is far, far too little. And the effect with this is the autonomic nervous system. And the autonomic nervous system has nerves going to every organ in the body. And it's so interconnected, much more than other parts of, especially the peripheral nervous system, that it doesn't matter where you start it, it will go all the others very quickly.
Really? Okay. The brain always just seems so complex that you'd think it'd have to be specific, but
No, it's literally the most complex entity in the universe. Okay, this is alcohol. This is to get off what I just put on, but also to get off oil and to make a better connection also.
so you're going to ruin my makeup?
Hopefully not. So yeah, this is for ongoing sessions. It's probably better if you don't wear makeup.
Okay.
Now what I'm putting on now is just conduction paste, which its point is to hold the sensors in place, but also it's really just a salt paste, and it helps conduct a tiny current from the skin to the sensor. So it has a function that way also.
So I've been reading a little more about neuroplasticity, and I know they're making advancements with understanding the brain. So is this a part of like creating neuroplasticity?
Well, neuroplasticity is a general word, and it can mean a lot of different things. Basically, it's any change in the nervous system, any change. And so certainly this affects the nervous system, and it affects change, and it's definitely related to neuroplasticity.
Because I know that was such a big break, just what I've been reading was such a big breakthrough, because people used to think once your brain's
Yeah.
traumatized or there's damage, you're done. And so for me, just exciting to know, oh my God, there's actually something that I can do about it, and then there's advancements being made.
Well, when I trained in medical school, that's what they taught, that you didn't grow any more neurons, that there was no change once you're an adult.
Yeah, which is pretty scary this started really getting bad when I was about 40. And I thought, oh my God, am I done? So it was nice to start reading and finding that there's different things happening.
You'd hate to be done for it when you're only 40.
Yeah, exactly. It's not fair.
So we clip this, just so it doesn't pull away. The different colors have to do with the location
Okay.
on the amplifier processor. And it determines, that's how we know the function of each sensor. And so basically, in the front, you have two sensors, which are the active sensors. And then, as you'll see in a minute, I'll have two on each side on the mastoid process, the mastoid bone. And those are what we call the reference. And when we measure the circuit, the current, then we really take not just the active measurement of the active, but the difference between the active and the reference. And that gives us a more accurate reading on what the frequency is. And then one's the ground. And that's the blue one here. And it's not a ground in the conventional sense, but I don't really know that well, but it's a multi-modal or a common mode rejector. In other words, it takes what's common to all the other sensors and takes them out. And that reduces the quote-unquote noise and helps make it more accurate also.
Okay.
Okay.
It's
So
all new to me,
again,
so I'll just sit here and
okay. So
see what
again,
happens.
your job is to just sit there, pay loose attention, not do anything special, and to let me know as soon as you notice that you're feeling different in any way than you do right now. So you might feel relaxed, you might feel more grounded, you might feel tired, you might feel a little spacey, you might feel some warmth and tingling someplace, anywhere on your body. You even might feel a tiny bit of nausea, just anything. And I want you to tell me as soon as you notice anything. I don't care if you're making it up, if it's placebo. I just want to know what you're experiencing as you're experiencing it. Okay? And I'd rather you know something you're not sure of than wait till you're sure of it. I just want to know in real time what you're experiencing as you're experiencing it.
Okay.
Okay?
I can do that.
So on a scale of 1 to 10 right now, where 10's a panic attack and 1 is so relaxed you're about to fall asleep, what would you say you are right now?
5.
Okay. Okay.
Just probably because I've been sitting here. But then that's all relative because I can go into extreme stress.
Right. That's what we want right now is relative. Something that will help me figure out during this period while you're getting treated what changes.
But then again, if I sit there and actually think about it and focus on my body, I'm probably more of a 6 or
Right.
7 because I am tense.
Right.
But I think I'm just used to being tense most of the time.
Okay, one of your sensors is off, so I'm just gonna.
Okay.
Yeah. Excuse me.
Sure.
So sometimes they pull away, the sensors pull away, and sometimes it's just the angle of the wire that's pulling it away. Okay, I'm just going to show you. This is just, I call it bowling ball head, but these are just the standard places on the head where we put sensors. It doesn't mean anything.
Okay.
And here we look at the impedance, which is resistance, how well we have a connection. So the lower the impedance, the better. And we want it to be that you can either have green, yellow, or black. And ideally, we have it yellow or green. And so we're ready to move on.
Okay. It's all new to me, but I'll trust that you know what you're doing, what's going on. But it looks very interesting. I see the light flashing, so does that mean it's running?
Well, that means it's starting the application.
Okay.
It's not on quite yet.
Will you let me know when it's on?
Now it's on.
Okay.
But you don't notice anything.
I don't know. Not yet.
So as we do this, I'm going to keep reminding you what you're noticing, if anything. Sometimes.
I actually did just feel something relax right
Okay.
in here.
Okay.
And I don't know if that's placebo or not, but
Doesn't matter. And
I just took a deeper breath.
okay. So you get a sense of how fast this can take place.
Yeah, because actually, a lot of times I hold my breath. I don't realize I'm holding my breath.
Right.
But I just noticed I just started breathing more.
Right.
Or taking just not trying to take a deep breath, but I just naturally just took a deeper breath.
Right. And so what number would you say you are right now? Before you were a 5 on the scale of 1 to 10?
I think I was actually more like a 6.
Okay.
Yeah, realistically. It's interesting. I feel more alive, awake.
Mm-hmm.
So I guess, I hate to say it, but, if I've taken a drug or something like that and it starts to kick in,
Right.
it's that feeling of slightly elevated, a little more relaxed. Not extreme in any way, but
Right.
just
Well, let me know if you
feel
start
a little happier.
if you start feeling giddy, let me know. But when I'm working with a patient, especially the first time, it's not always so helpful to ask, what are you feeling? Because you
Right.
might just say tired. But I don't know if you're tired beforehand and you're just
Right.
tired now. So the question to always ask in comparison is, are you in any way different than you are when we started? Are you any more tired now than when we started 2 minutes ago? So there's got to be a reference point to see if there's a change, not just if you're tired or spacey or any attribute actually.
Yeah, I was feeling a little tired before we started.
Right.
But now I'm just feeling like things look a little different.
Right.
I guess a little spacey,
Okay.
but not a bad spacey, kind of an enjoyable spacey.
Right. Right. Well, actually, we're done for today. Now, this is not uncommon that it's this quick, but most people were at it a few more minutes than this. And I know already that you're going to benefit a great deal from this treatment.
I can say I like this feeling.
Because
it's a really nice feeling.
if you benefit in the beginning, you end up having good circumstances. You end up good results. And so to maul Shakespeare a little bit, it's all's well that begins well. So it's unusual to have someone begin well and not end up with a really good result. Now, how you're feeling now is probably the best you're going to feel during your whole time at treatment. Usually the first session is the most dramatic.
Okay.
But enjoy it while you have it. And people usually end up about 80% as good. And most people are very happy with that. And we'll move forward. I have a take-home sheet to go over with you. And you're observing what happens to you and how long the good feeling lasts. And then even once the good feeling is gone, are there still changes? Like, are you more resilient? Are you able to deal with circumstances that might normally bother you better? So for many people, there's 2 parts to what you experience. Is the first part where you feel really good, but then the second part, and just as important, is are you doing better? Are you resilient? And so I want the total time actually of both. Occasionally people have more vivid dreams around the time of a session, not usually, but sometimes. And I want you to know that I like to get in touch with all my patients within 24 hours, just to touch base, see how you're doing. And you can call me at home. I'll give you my personal number if there's anything happening. Usually when someone calls me, they're scared. And what they're scared is pretty much always the same thing, is did I do something irrevocable to my brain? And the answer is always, always, always no, not ever. 100% of the time, the answer is no. So no matter what you experience, plenty of people have experienced it already, and there's nothing to worry about. But it's better when you hear from my voice as the clinician than me just telling you right now.
Yeah. Well, I appreciate that there would be that reassurance, or if I do have questions or something's coming up for me, because I've had treatments before and then I've gotten really emotional,
Right.
and not necessarily any help.
Right. Well, this is going to evolve.
Support.
I don't know you yet, but it may evolve over a few hours or a day or two. You might end up being more tired a few hours from now and feel like you got to take a nap. And you might start feeling a little more spacey, almost like you've had a drink or so. Now, actually, that's the biggest danger in doing this. That if you feel spacey and you go home and drive, you can get in an accident, and that's what I'm always concerned about. That you don't drive home until you're really clear enough to do that.
That's
So,
interesting. Yeah, because I feel happier right now, but I also feel spacey and a little tired.
Right. So I suggest just waiting here. You can go take a walk. Come back in half hour. It'll probably all be gone by then. And let me just touch base with you then. You know, worst comes to worst, you'll take an Uber home, and you know we'll deal with the car.
Okay. Well, I can
Okay.
relax and go get some lunch.
Okay. Okay.
But thank you
Okay.
for that. And
Okay.
just thanks for letting me know so that I know kind of what to expect
Yeah.
or possibly what to expect. Yeah.
Well, I'm happy. I'm happy you responded well.